Internet is so much fun. I know. Corona is trending fast. I know. Some are scary, some are funny, others too fake news. Then don't share. Why not? Go to the right place for Corona news. Spreading lies can hurt. Share the facts, not those memes. You might save a life. Save a life? Yes, save a life. You can play your part. Children like us can also play their part by sharing only the facts? Yes, spread only the facts. Play your part too.
Be the one to spread only the facts from the Ghana Health Service. Play your part. In case of any emergency on COVID-19, call 112 or 311. This is brought to you by the Ministry of Health, Ghana Health Service, and UK Aid.
Hello there. Welcome to Trend Africa, where we give you the best of live streaming across all states in the US. We also do web designing, event planning, MCing, app creating, and promotions. Or if you want to shoot an advert for your business or a show, you can contact us on +1773 312 0318. For more information, you can visit our website at www.trendafricaonline.net and also on our social media platforms at Trend Africa TV. You can download our app Trend Africa Online on the Google Play Store and App Store. Trend Africa, redefining Africa.
Royal Black is Fiaba, Maka. Entertainment and sports, Maka. I say politics, Maka. Royal Black is Assembly Safwa, Bia Assembly Puno, Sanepi Adekabi, Ekomeya Kotokumi, Ekomeya Misebe, you want love fake hanging, Maka. Royal Black is Fiaba, Maka. All the trending issues, Maka. I say politics, Maka. Entertainment and sports, Maka. RBJ Diaba, where you full from cry. Asemi Safwa, yeah, Asemi Puno. Sasemino Ba, yeah, Becca. Senya Betino, Sabape na Yebekano. Maka, Akasane Kwedewo. What by you no ni one na jeno na ke. What by you no ni one na jeno na ke. Say your politics RBJ Becca, or Becca, a sports RBJ Becca, or Becca, entertainment to RBJ Becca, or Becca, trending issues RBJ Becca, or Becca. Maka, yeah, diabao, Becca. Maka, yeah, diabao, Becca.
My name is Eunice CROMWELL and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Good evening to all and welcome once again to another episode of the health segment on Trend Africa TV. My name is Dr. ARABA and as usual, I will be your host. I'm a family nurse practitioner. Today we have a very exciting episode. We spent the whole month worrying about or focusing on healthcare in Ghana, but today we will be speaking to someone from Chicago who is making a big difference in our community. Let me give you this opportunity to go ahead and share the feed, invite your friends and family, and we'll be right back. Stay tuned.
Are you sick or have a health emergency and don't want to wait in long queues at a hospital, especially during these times of COVID-19? Worry no more. Dr. Now GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Now GH app from your phone's app store. Don't wait. Hurry now to sign up for free. Dr. Now GH, your doctor is now at your fingertips.
My name is Eunice CROMWELL, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for joining, and a big welcome to everyone who has just joined our feed. Today, we are going to be talking to a gentleman who has really done a lot in the community and who is doing a lot with his education. We know that health and wellness is a word that is used interchangeably. When you hear the word wellness, we see it marketed everywhere. We look at commercials, magazines, in the grocery aisle, and even food packaging. Despite the heavy marketing, wellness is more than just a buzzword or trend. Wellness is also an active process of making choices toward healthy and fulfilling life. What does that want to look like? By managing our nutrition and our exercise, we can all achieve this wellness goal. Today, we're going to talk to a gentleman that knows all too much about health and wellness. Our guest this evening is none other than Mr. Isaac Edu-Jemfi. He is a podiatric medical student, certified fitness trainer, health influencer who focuses on inspiring and educating others. Isaac is a graduate from the University of Illinois, where he obtained his bachelor's in psychology in 2017 and recently obtained his master's in biology from UIC Urban Health Program. Isaac uses his social media platform to promote healthier lifestyle habits and general wellness, as well as teaches people about podiatric elements related to his training. It is his aim to improve the quality of life for all those he encounters. We are very grateful to have him joining us today. Isaac, how are you?
Hey, how are you doing? I'm doing well.
Very good. Thank you so much for honoring our invitation. We know that everyone is very busy, but we wanted to go ahead and catch up with you and just kind of find out everything that you've been going through, all the great things that have been going on for you. Congratulations to you, by the way, on completing your degree.
Thank you so much.
To you. You're welcome.
Thank you so much.
So we know in general there are a lot of obstacles when everybody is trying to achieve education, lots of struggles. So we just want to give you this opportunity to kind of share your story. We've seen what you've posted on Instagram, and that's what prompted us to have you on our show. We believe in empowering all of our youth, and being someone who's been in the Ghanaian community for a long time, we thought it would be wise to bring you on and kind of just explain what, your struggles and everything and how you were able to make it through. So go ahead and tell us.
Yes. Thank you for having me here. It's actually been a very blessed time for me transitioning. As you just mentioned, I just graduated actually with my master's degree in biology. That was from Roosevelt University, but my undergrad was at UIC. And so, education wasn't something that was just easy to come by. I believe that being a first generation, student, it didn't afford me all of the resources and access that I wish some of my, other peers who had. And so that was already difficult for me. And so I had to struggle and figure out ways on how to learn. It's a difference between, how your parents would say, go and study, go and learn, go and read your book. But it's a different beast when you are trying to learn. Learning looks different for everybody. And so it took me some time to try to grasp that sort of concept. And I'm very grateful to be able to get a master's degree and learn effectively how education should be, absorbed as far as, longevity instead of short term. And that helped me with my transition into deciding how I wanted to pursue the next level. And so I'm very grateful for my master's degree, and I'm very prepared now for my medical education that I'm about to pursue. And I think that that's going to actually set me apart from a lot of others when I get there.
Absolutely. That's very interesting. So you said that it's difficult based on what your parents saying, based on what you went through. So what is the difference? Because, all of us, we all have African parents. A lot of people who are watching also have Ghanaian parents. And we know, the strive for education is what they all want for their children. So how do you think you were able to overcome that? And what changed with you to be able to help you focus on your education to get to this level?
I think, if I'm being honest, I know that our parents always want the best for us, education wise. And I think that, they do need to take I would say, far more of initiative to introduce us to some of these different healthcare fields and other fields that are out there.
Okay.
You know, there are people who didn't really understand what public health meant until they met someone else, you know, because all we know is doctor and nurse, or a lawyer or engineer. But there's so many different sectors of healthcare that didn't stick out to me, and I didn't know I really enjoyed until, you know, I was placed in these environments. And also, you know, I really think that a lot of times our parents are so gun-ho on the idea that, you know, X, Y, and Z, or the next person can do it. Why can't you? You know, and a lot of times it's not that. Like I said before, it's about understanding how you learn. And so as a parent, you have to recognize that your child is having trouble in, you know, certain coursework. It's not that they can't get it or they can't do it. I think it's really about their system of learning and understanding the material. You know, that takes time sometimes, and some people catch on a lot quicker and some don't. I think that what I do know, that especially when it comes to people who are set apart, especially meeting in my academics, what I've noticed is that some of these students were put into programming things that supported their habit to learn very early. You know, and I think that made a difference for a lot of people. You know, a lot of times we are expected to learn and to do all these things, but we don't know how to do them. Exactly. And so when you learn how to do them, you can do them effectively. And I think sometimes that's what the missing link is, the missing piece. I know our parents want what's best for us, but it's not just going to study your book. It's about how you study your book, you know, and sometimes they can't teach us how to study our books, you know, and that's one thing I do want all of the youth to understand, is that, hey, it's not just you. And you also sometimes have to tune them out. And I know that it sounds crazy, but you also do have to tune them out at times. There are people who I've met who transitioned from saying they wanted to do pre-med into nursing, and they have an awesome career. But at that transitional stage that they wanted to do it, their parents were very supportive because they didn't understand what they wanted to do in the long run. And so I realized that, you know, early, that I can be an advocate for other, you know, youth in the community. And so for a long time, I've been doing peer advising, you know, giving them the essential tools that they may need. And with that peer advising, it's like, hey, like, I know your parents say, oh, you want to do medicine, but you looking into dentistry, you like it a lot better. You can look into those things, and I'll help you look into those things. And I'm very grateful for that. I think that a lot of times too, they become flustered. They don't know the trajectory of what you're doing. They don't know that it takes what it takes, you know, mentally and physically to get to that level. Yeah, and not everyone is going to have the same trajectory. Not everyone's going to have the same road. And so understanding that, I think, and having that patience is really what people should be afforded, especially around my age and younger. You know, there's people who are in my program who are, you know, almost twice my age. So it's not really a matter of, oh, do it, but it's how to do it. You know what I mean? How to, yeah.
That's very important. I'm happy that you said that, because there are a lot of people who are watching. Ghana National Council is a strong advocate, along with Trend Africa TV, just on promoting excellence, making sure that we're keeping up with all the youth in the area. And so I know there are a lot of people who are going through a lot, trying to figure out exactly what they want to do. And so you mentioned you got your undergraduate. So at what point did you realize that you wanted to be a podiatrist? Because podiatrist is a wonderful field, specialty field. Not a lot of people go into it.
Yeah.
What made you decide podiatry?
All right, that's a good question. I first and foremost figured out that healthcare was something I wanted to do, just based on the health disparities and the health inequality that I saw in Ghana. Okay. Right. And I saw that those same health disparities and health inequalities mirrored those that were in Uptown in Chicago, in my neighborhood. They both had very similar commonalities. And once I realized that they both had similar commonalities, I thought to myself, I said, well, Ghana's still a third world country, as they say, but how come that access to healthcare and, you know, healthcare in general is still something that is still a debate till now? And what I realized is that there is no difference. Access is very important. And I'm also gonna switch my seat for a second, just to get more.
Go ahead, please.
And I think that access is very important. And with that access, you know, takes a lot of work.
Okay.
And so I think that ultimately, one thing that really stuck out for me when it comes to podiatry was the fact that I can have a multifaceted approach to things. Okay. And the one thing about the podiatry that people don't talk about is that it's actually a hidden gem in medicine. Okay, it's not really spoken enough. It's not. it's not idolized. But one thing I have realized is that nonetheless, right, that the field of podiatry is something that is needed in our community, and not just our community, but those that are around. And what I've noticed is that there are diabetic patients in Ghanaian communities, right? And there aren't enough advocates, if I may say, because at the end of the day, it's all about saving others. And I think that there needs to be more people that look like me in order for that to happen.
Absolutely. I love that. And you're right. Podiatry, as a provider myself, when I think about podiatry, I'm always connecting with them, with my diabetic patients, right? Because our recommendation says that we need to have them see a podiatrist to make sure that they're doing foot exams. A lot of my patients, when I say podiatry, they're like, "Oh, I don't need a pedicure," and I'm like, "It's so much more. It's so much more. We got to make sure neuropathy is not there. The foot is nice and healthy." So I'm happy that you're going into podiatry, and I do agree that we do need more people that look like you to be able to express what podiatry is. I like the fact that you touched on Ghanaians, of course, in terms of preventative medicine. We know that many of our Ghanaians have hypertension and diabetes. So it's a great field that you're going into. You spoke a little bit about your culture and what it means to do, what it means in terms of school. So I'll just ask you, do you think that your culture upbringing, being where you are from in Ghana, also with your faith, contributed to allow you to be where you are today?
Yes, entirely. I think that, being a Ghanaian, it kind of shifts your mind, it kind of makes you think, hey, like I can't save everyone, right? But I want to do as much as I can and being involved as much as I can. And what does that look like? How much can I support? How much can I help? What can I do? And for a young age, I had the idea that I wanted to do something in healthcare. I didn't know what specifically. I didn't know if I wanted to become an internal medicine doctor. I didn't know if I wanted to become a dentist or whatever the case may be. But once I realized there's a need for everything, I realized that, what? I can pursue what makes me comfortable, makes me happy. There's so many fields in healthcare that you can find for yourself as a person that molds your lifestyle that you want in the future. And I think being a Ghanaian, I wanted to be able to take whatever it is that I learned and acquire here back home. To try to alleviate that stress of access to healthcare, because it really does matter. And I think that as long as I am alive and, the other youth that are here, we're going to be the next ones up. And we have to be able to take these roles that are needed. Our parents are not getting younger, they're getting older. And what does that mean? That their ailments and et cetera fall on us to care for them. So we have to be able to do that. Yeah.
And have you encountered, so again, podiatry, when I think about podiatry, I really have not spoken to someone who has chosen podiatry like upfront. I have a lot of peers. I speak to a lot of people and they say, "Oh, I tried this, I tried that." And then through clinical rotation, I'm like, "Oh, wow, I'm going to do podiatry." So for you to be choosing podiatry straight up front is amazing, first of all. And I wish you all the best. But what do you think about podiatry really drew you in there?
Well, I'll be honest, okay, so my undergrad, I was kind of torn. Like I said, I really didn't know exactly what. So I did that. I tried a little bit of here, I tried a little bit of there, and I still didn't have my decision made. And I wasn't really gung-ho on everything. I knew that the things that I wanted to do were definitely be able to handle things surgically.
Okay.
I knew that I also wanted to have an immediate impact on people's lives. And it was my master's program when my first year, literally in the first year, and they bring people out for us to, hey, what do you guys want to do after this? Originally I was like, okay, well, I might just consider getting a PhD in biochemical sciences.
Oh, wow.
So I was living literally in biochemistry, and I really had an interest in biochemistry. And so entering my master's program gave me that access, and I met other Black podiatrists who, when questioning and speaking to them, always said I made the best decision and the best choice. That was important for me. Every time I spoke to another person who looked like me in the field, they said it was the best decision I ever made. And I think that's what really reeled me into the field. I said, I can have this much impact and still be happy, then I'm going to pursue this field. And I look at what they do on a daily. Dr. Johnson, who just finished over at UPenn, clinical wound care and scientific pathologies. And with his specialty, he's producing so much, manuscripts and research, right? And impacting people that look like us, impacting our communities in the way that care is done. And then I meet other people like Dr. Ugo, who works for an ortho clinic, and the type of impact he's having on people who couldn't walk before can walk now.
Yeah.
So once I started to meet these other people who looked like me and realized they were happy, they were in a good profession that was making a difference, it was a no-brainer for me. After that, I was signed on. I was like, hey, this is it. I'm going to be gun-ho about this. This is what I'm going to do, And I'm blessed to be able to have that opportunity to meet these people in order for me to even have that, that specific mindset that, hey, I want to pursue podiatry. Because like you said, it's not something that everyone, has a gun-ho feeling on or wants to go into directly.
Right.
They find other ways that lead them into podiatry, which is very true. Yeah.
I think that is so amazing and important that you were able to meet people of color that were able to inspire you. So at what point did you meet these people? What opportunities were given to you to meet these people? Did you just meet them? Did they come for conferences at their school? Did you reach out and go to maybe things that they were doing? How did you be able to get that?
So definitely, my program had some conferences in which, they brought different schools that were from podiatry. So we had podiatric medicine that would come by. They had nurse practitioners come by. They would have other physicians come by from different programs. And, in listening to all of these different, programming and things that they had for us, everyone had the same kind of mantra: you can help, you can create change, but I think that, like I said before, being able to speak to them, like I said, was important. I was actually connected to them through friends and family who are also physicians themselves.
Hi, my name is Ochiame Kwame, the rap doctor, and I have something to tell you. When you need a doctor, you mustn't go anywhere. All you have to do is to call Mobile Doctor. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they'll give you an amazing discount. Mobile Doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile Doctors, the doctors in your home.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you so much. And sorry about that. I lost my connection. So we'll go ahead and let him continue. I'm sorry, Isaac. Please continue.
Yes. So, as I was speaking before, just about being able to have that ability to meet other people. And fortunate enough for me, my family are pretty well known enough for me to have connections to meet some of these people. And through them is kind of how I met one of the Black male podiatrists I was speaking of. And so speaking with him, he's the person who connected me to another podiatrist who later on became my mentor. As I've spoken of, Dr. Johnson, who went on to UPenn and etc. So yeah, and I think it does matter, like you said, to have the resource to connect with others, because if it wasn't for that, I wouldn't have been afforded that opportunity. So I'm very lucky enough to have that. But that's the reason why I want to be the person who pushes what podiatry is in our community, because I know there's so many others who might be looking for this gem in medicine.
I love that. And I love the fact that you called it a gem of medicine. That's awesome. And so for everyone who is in school and looking for something to do, I just want to encourage all of our youth. I think it's important for us to reach out. You know, when you are networking on Instagram and Facebook, one thing about me, I'm always looking out for anyone who's doing anything education related. And everyone who knows me knows that I'm a sucker for good education. So please make sure that you are reaching out to all these people. They are more than willing to talk to you. He just said he was a peer mentor, so I'm sure that he'd be able to talk to anybody who's looking to, you know, kind of find their niche out of school, someone who just finished his bachelor's and his master's. And that is the reason why we brought him on today. So let's go ahead and switch a little bit and talk a little bit about your company. We know that you have a company, Risen Elite. So go ahead and tell us when you got that started, what motivated you to get that going. You can go ahead and tell us about Risen Elite. Sorry.
All right. So Risen Elite came to me actually during quarantine. Prior to that point, I had been doing fitness and I wasn't taking it seriously, but I worked out every day. And so what I realized is that I wanted to do more. And once I recognized I wanted to do more, one of my friends definitely kept pushing me. It was like, hey, you should definitely start your own company. You should definitely be training people. You should definitely provide that to others. And I fell in love with fitness. Fitness has been a part of my life for a very long time. I've been an athlete since I can remember. And one thing that I do know about Risen Elite is that I also want to help others be able to attain the type of health and aspire to the type of health and the type of lifestyle change that I went through.
Okay. Okay. Good. And I'm glad you talked about lifestyle change. So the messages I've been getting all day is about lifestyle change, right? Everyone is trying to find a way to keep fit, right? Everyone's trying to find a way to make sure that, you know, they're aligning their diet with their exercise and everything. So tell us about how you were able to do it, because it's, you know, it's very, very difficult. We all go through lots of changes. People lose weight, they gain weight, they become less motivated about the gym. But we've seen for over some time, when we did a little bit of research, that you've been consistently very focused on your fitness. So tell us what got you there.
And that's a good question. And the reason why I stopped is because I want everybody to know that sometimes it's okay for it not to be consistent. You know, sometimes it's okay. You have to understand when your body needs a break. And I'm going through that right now. My body needs a break, you know, and getting back on it is not going to be easy, but getting back on it is ideal. And that's the reason why we talk about lifestyle change. If you create a healthy lifestyle change, it's not going to feel like you're going through a 21-day challenge. It's not going to feel like you're going through a diet for 30 days. It's not going to feel like that because you created a lifestyle that supports your healthy habits. And in doing so, you can obtain your physical goals that you may want. In order for me to continue with my consistency, what I realized is that I had to just get there every day. Just get there. You know, sometimes it just takes you walking inside the gym. Even though you don't have the energy, you may be tired. Once you get inside, walking inside that gym will change your mindset, you know? And fortunate enough for me, that's enough for me to keep powering through. I can train by myself, work out by myself, and be motivated enough to finish my workout. And I know that some cannot do that. And I know that some people need a little bit more of a push, need a little more guidance. And so that's why I started training others. But one thing I did want people to carry on was learning and tricking your mind, because what's really what it is a mentality, tricking your mind into thinking like how I think. I got to get there every day.
Okay.
Hey, I got to get there. I got to get there. Hey, I'm stressed right now. Let me go to the gym.
Okay.
Hey, I'm angry. Let me go to the gym. Seriously, and creating that type of mindset, you know, that's very helpful. You know, my stress went down. You know, all of my levels are very much healthy prior to, anyway. You know, but I realized that taking care of my body now is important for tomorrow, important for the future. You know, so many people, some of my peers that I got in, they will go and eat 5 benkum, and then they will be drinking all the Heineken and everything when they're 26, 27. By the time they're 30, they have the big belly, the granddaddy belly, you know, and then they're trying to get fit, which is okay, but you have to understand what your body went through.
Right.
You put your body through all this stress. You put your body through all of this. And Getting back healthy isn't a problem, but understand that has taken some parts of your body. You know, you won't be as optimal as you can be, if you get what I mean. Yeah. So it's definitely a lifestyle change, like you said, but healthy habits and being able to have the determination and drive to keep going. Everyone can have that drive. It's about why you're being there. What do you want? You know, at the end of the day, what do you want? It's not going to come in 30 days. Some people, some people can do a 30-day challenge and lose weight and etc. And that's because that's the goal. Everybody's goal is to lose weight, but my goal was just to be healthy.
Right.
You see?
When
it's just
for longevity.
Yeah, I wanted my longevity. Like I still eat kinky, I still eat benku, I still eat jollof. You know, when I wanted to look a certain way, I wouldn't eat those things. That's very true. But if you want a healthy lifestyle, you can have a healthy lifestyle and still be a moderate size. It's just about portion control, you know, and how often you are eating these things. Ghanaian food is amazing, but one thing we need to understand is that we don't live in Ghana anymore. In Ghana, the sun will beat you and you will lose weight by force. You can eat as many carbs as you want. The sun will beat you. But you have to understand, in this country that we live in, there's not much sun, number one, and number two, you are always idle at work. Some people are very idle at work. And if some people are doing laborious work, they overeat at the end of the day.
Right.
You know, so it's not the same. In Ghana, you can have one big plate of fufu, and that's it for the day. You're good. You're set. You know, you have to think differently when it comes to your health. You have to really plan how you eat. And that's all it takes.
That's amazing. We are going to take a quick break. When we come back, we're going to hear from Dr. OFORI, get a couple updates about what's going on with COVID-19, both here and in Ghana. And then we're going to get back to our very interesting conversation with Isaac. Stay tuned. We'll be right back.
This is the Ghana Agenda, and my name is Alfred Amuzu. On the Ghana Agenda, we talk about political and financial related topics occurring in Ghana. We try to break down some of the most complicated issues, and we make sure that all our listeners leave the show with something at the end of it. Again, tell your friend to tell a friend. Alfred Amuzu is on every Sunday on the Ghana Agenda.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Hey, this your girl coming all the way from the US of A, ya baby, aka ya Phantom. And me di feel a buzzing pan and to see one virtual the money how Ghana mata da romantic. With me sandy provisions, as I such credit Emma Ebusuya phone and for more Ghana. And one say ubako www.ghanamat.com. And they would say boy a sharp connection www.ghanamat.com. Let's provisions in credit na very zankasa. I have friend numbers na mo screen na seno. Ghana Mat ye krano.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Welcome back. We are having a great conversation with Isaac. He's been teaching us a lot of things about his new field he's going to be going into, a lot of things about fitness. And don't worry, we are going to get back to that amazing conversation. But we do want to go ahead and switch gears a little bit so we can find out what's going on with COVID-19. So let me take this opportunity to introduce Dr. OFORI, who always sits down on our professional panel. Dr. Edward OFORI is an assistant professor of pharmaceutical sciences at Chicago State University. He is a pharmacist by training. His research focuses on drug discovery and neuropsychiatric disorders, including schizophrenia, depression, and substance abuse. Dr. OFORI, you're more than welcome this evening. Thank you for joining us.
Thank you for having me, and thanks to all the listeners.
Absolutely. Tell us what's going on with COVID-19. Everyone's talking about the Delta. I see you already have it up. The Delta variant. That's what we've been hearing about. What's going on with it?
All right. So, like we do all the time, we try to provide updates on what is going on in the COVID world. We do have a Delta variant for sure, and it's causing a lot of issues, especially around the world, in places like Indonesia, India, and even in the United States. It's the Delta variant, as we're going to learn, is highly transmissible, even more than the B117 from that was first discovered in the British countries, right? So we do know that as we have all these highly transmissible variants, there's a high tendency that you're going to have more infections, especially among unvaccinated population. So as you look around the world, as we speak now, there are almost 4 million people that have died from this infection, this pandemic. We do have some recoveries, but then we are losing more lives every day. And then, as you can see, countries like the United States still continue to lead in numbers of cases daily. When you look at India and Iran and Russia, they're trying to, kind of having a lot of cases, especially in Brazil as well. If you took a cursory look at the numbers, you see that, of course, US still has the highest numbers because of what happened in early this year and so last year. But in the number of deaths, new deaths, you can see that Brazil is taking the lead in that direction. If you go to places like India, you see that the number of deaths is also going up, but then it's not comparable to when they had the initial stages of the second wave. So globally, we are seeing some trends in some areas where you have spots of, could be fourth wave, third wave, depending on how you look at it. What it means is that, especially when it comes to the Delta variant, there's going to be more cases in areas that don't have vaccinations. And I've highlighted that earlier on in one of our programs that if you go to Africa and all these poor countries, we don't have that amount of vaccination as you see in the Western world. So we tend to be a higher risk, and therefore we need to engage in activities that actually prevent infection among people. In another news, when you go to Ghana, you take a look at our numbers. We're almost a little bit shy of 100,000 cases as of now. Looking at how much tracing and testing that we've been doing, we see that our graph, as you can see, kind of plateaued, right? But then it has this, I always call it the cobra head, right? It has that tip right there. And as you can see, as it goes up all the way to July 2020, you see that it's trying to go up, right? That's a sign that if you don't take care, if you don't put all the measures in place, you're just going to have an uptick. And as we stand now, we are just a little bit shy of 800 people that have died from COVID in Ghana. Looking at the data that are collected from the Ghana Health Service, our positivity rates not looking great. We still have a lot of cases that sometimes are going undetected in Ghana as well. So it's something that we need to pay attention to in terms of how people are congregating. And because we have these variants coming up, I think we need to be aware that the COVID hasn't gone anywhere and we should be very careful. Same data from Ghana Health Service shows that, yes, indeed, we're doing well in terms of, testing, but then you can see there's a dip in testing after April, right? Kind of tells us that we need to be careful because we might be having spots of people get infected, but not really being tested. However, one thing you cannot escape when it comes to pandemics is hospitalization or increase in demand for healthcare services, which we haven't really seen that much in Ghana, but that doesn't mean that we don't have cases going up, of course. After a lot of people congregated recently, there's been uptick in the numbers as well. You can see the same trend on this diagram, which pretty much shows that there's a decline after March, which has stayed plateau. But you can see, like I mentioned, there's that, kind of uprise. You can see the tip of the graph. And what that means is that if you don't put those measures in place, you're going to see the same thing that you saw in May last year, and also somewhere in December last year. In the same token, when you look at vaccination, which is the only weapon that we have, we are seeing, especially in the US, there was an uptick in April. You can see the graph goes all the way up and then it comes down. What it means is that not too many people are getting vaccinated. We do have certain areas in the US, Illinois is about 40 something percent. You can see California and all these places like New York, you can see they're in green, which means a lot of people are getting vaccinated, and you tend to see lower numbers in these areas that have been vaccinated. We also seen a trend in places like Wyoming, places like Arkansas, and all these places that are experiencing like upticks in numbers because their vaccination percentage vaccinated is below about 30%. What it means is that you're going to see spots of kind of not a pandemic, but epidemics of or breakthrough kind of infections or increases in numbers of COVID infections because of unvaccinated populations in these areas. Yes. In the same way, if you look at Illinois, right, we are sitting at 46%, which is quite surprising. But the good news is Chicago has a very high percentage. I think it's about more than 60% of the population getting vaccinated. The good news is that the adult population, those who are 65 and above, averagely across the country stands about more than 85% of them have been vaccinated, which is great news because they were the most highly affected when you talk about mortality rates. Now, if you want more information, you can, if you're in Illinois, you can go to Illinois Department of Public Health to see where you can get vaccinated as well. Now, again, Delta variant, I already spoke about it. It is about 40 to 60% more transmissible than the B117, which kind of creates a little bit fear among unvaccinated population, especially children, right? Pfizer just rolled out, their clinical trials for children 5 years and up, hoping that by the beginning of this fall, we'll be able to have vaccines available for children within that age range. So all fingers crossed, we are hoping that children who are open to be vaccinated can get a vaccine. But again, if you have the opportunity to get vaccinated, please do, because we're seeing clear evidence against all conspiracy theories that the vaccines actually do work. So if you have the opportunity, please do get it. Right.
Absolutely. And we know that July 4th is coming up. People are going to be having barbecues and everyone's going to be getting together at the park. So I think that it's wonderful that you share this information. I saw on the news that some people were giving recommendations to go back to wearing masks inside the buildings again. Where do you think that's coming from? Are we really seeing that much more of a spike? And I saw that you said that Chicago had a pretty good rate. So how is it looking for people who are planning to just go out this weekend without mask on?
So mask is always going to be something that, in as much as we don't like to wear it, is as protective as a vaccine if you wear it effectively. So, even though people are vaccinated, because the vaccine is not 100% protective, okay. And some people still, even though the antibodies are able to protect you, the lifespan of these antibodies, we still don't really know. We know at least a year or so can offer some protection. We do not encourage people to congregate, especially when you don't know the vaccination status of individuals, which I already indicated is going to be problematic in the sense of rolling out, removing these mask mandates in certain areas is going to be problematic because you will not know who you're next to. Therefore, if you're wearing your mask, I would say that's okay. You can go ahead and do it over the time that you stay in there. If you're vaccinated, your protection is very high. Chances of contacting and having severe forms of infection is very low. But again, there are different variants coming out every day, and we don't know until someone gets infected. Even though We do sequencing a lot. In other countries, the United States sequencing is not that fantastic, and I'm not proud of it. But if you go to places like the UK, they do a lot of sequencing to be able to detect different strains. So what I'm saying is that it's deadly. The virus is deadly to some extent, especially in certain vulnerable population, and therefore, if you're going into the area where there's a lot of congested people and you don't know the status of a lot of people, wearing a mask is okay. It doesn't harm anything.
Okay, so we should still be wearing our masks. Now, we know that you just said that they've wrapped up the program that they're doing to check for vaccinations for children 5 and above. So what I do want to ask is, has there been any information given as to how long the COVID-19 vaccine is effective? I know that eventually maybe we're going to have to get a booster. Has any information been given? Is it going to be a yearly thing like the influenza? Or are we going to be good for like 5-10 years like other vaccines? What are they telling us?
All right. So as we speak now, we don't really know. There's several studies that have been done to kind of confirm the longevity of these antibodies that we do have. Now, one thing we should bear in mind is that your immunity is not just, it's not unique compositional, right? It's not just one. You have different factors. You have your cell mediated, you have your antibodies. All of these play a major role, even in people who are previously infected, have some level of some level of immunity that will last for maybe at least 5 months as we speak. Now, with a very high titer value of antibodies that we're getting or we're obtaining from these Pfizer and Moderna and AstraZeneca and all these vaccines, offers us at least 1 year as we speak now of protection.
Okay.
And because of that, by prediction, maybe if you're able to get a lot of people vaccinated, then you probably wouldn't need a booster shot. But because of the trend that we're seeing, following the current trend, in order to get 70 to 85% of population vaccinated, it's going to take at least the United States more than 18 months to do. Around the world, it's going to take more than 5 years to obtain that. What that goes to tell us is that it's a long shot from here. And because of all these variants popping up, I will not be surprised that along the line, we might need some booster shot to just protect us from some more virulent strains of the virus.
I see. And what you told us in Ghana, so it looks like in Ghana, they've kind of relaxed a bit. So I know at one time things were a little bit more intense and there was more of a push to do social distancing. We can see right now, just from following our news in Ghana, that more people are getting together in more larger quantities. We're seeing more people who are not wearing masks. And considering that they just got their second dose of the vaccines delivered to them, it's scary. Someone asked me yesterday what I thought about Ghana eventually shutting down again for a second time. And I think that it's definitely unpredictable, right? Because we're not really seeing very good responses there. How do you feel about that?
Yeah. I mean, as we saw in India, as we've seen in Bangladesh and certain parts of Africa, Ghana is not too special, right? So as we see, you don't say I beat the virus and then it creeps up on you. There's a lot of data coming from, international travelers going through Kotoka International Airport as to how they're screening these people in order so that they can prevent certain strains from coming to the country. Okay. We're still seeing cases going up regardless. So I will say that we should exercise caution because Ghana, we don't have that, strong healthcare system to be able to support people when they get really sick. What is really saving us anecdotally is that Ghana has a very young population of, I think, an average age of about 22 years or so, which kind of gives us some leverage when it comes to the number of infections. And I have a feeling that a lot of people are getting infected and are going undetected because some of them think it's malaria, but it's not. And they are recovering. So you're going to recycle these antibodies. And if you did some sort of surveillance antibody studies, you might be able to pick up some spots of areas in Ghana that have some epidemics that are going undetected. Because I don't think our testing and tracing is efficient as it was in the beginning, because we are not seeing a corresponding number of hospitalization as well. So in a way, yes, I would say let's hope that we get a lot of vaccines through the COVAX program and through the United States government and other Western countries that will get at least maybe 40% of our population in Ghana vaccinated. And that will go a long way to prevent any unforeseen calamity in Ghana.
Absolutely. Thank you so much, Dr. OFORI. If anyone has any questions pertaining to COVID-19 vaccines, either here in the United States or in Ghana, make sure you send your questions to Trend Africa TV so we can get those things answered. We're going to take a quick break, and when we come back, we're going to be joined once again with Isaac, and we'll continue our conversation. Stay tuned. We'll be right back.
Aona madonku nusiona wajila nyama uyelo afisi machoye madoma yina nyama uyelo yo nukonye nyakano si volta jata no gidigidi deka asienya hodo bi opa wona kla da mausi amasi woga yona be empress mausi alotu bazuku ayakla nutu sasa avasi wopa nukonye SB don kla togbi hodo dio we ha mojaka dede nya jojo wokla nyama jojo wokude avada konu de tonu afisi avawocho afisi wodo kla afisi wodo tai kama unu de afima wodo achonto hena wana siakle hajiji kle duduo alegbegbe inava melenu da ma usi vuvua ye opanu blanu makoma poto ena nyaba wole bobobo yadu na ma yigo ago na ma hodo ho si wona wota.
Welcome to SankofaOnline.com. Your #1 diaspora news portal has joined with GhanaWeb.com to bring to you the latest news around the world, especially Ghana. Visit our website at www.sankofaonline.com, or you can download our app from the Google Play Store or App Store. Sankofa Online, serving the Ghanaian Chicago community.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Actually, this beautiful Thursday evening, as we are talking to Mr. Isaac Edu, soon to be Dr. Edu. I know you love the way that sounds. It does. And we're all rooting for you. So tell us a little bit. You're going to be starting school very soon at Kent University. What made you choose Kent?
I think the decision to choose Kent was the support that they offer there at their program. And one thing I realized is that support is very big when it comes to education, and being able to absorb as much knowledge as you can at the time of your education. There were programs that I've been accepted to, like Rosalind Franklin, which is in North Chicago and New York. There's another program in New York called NYCPM. And these are top tier programs, but when I went to Kent, it was nothing different. It was something different. It was more like a family setting. Everyone helped one another. Everyone is supportive of one another. And I really felt the most comfortable there. And when I realized that's where I felt comfortable, that's where I wanted to be.
Absolutely. And so you'll be starting, when do you start the program?
The program starts the ending of this month. So July 27th is when I actually start.
Okay.
Yeah.
Very, very good. So we're going to all be rooting for you here. We wish you all the best. We're going to go ahead and continue talking about your platform, which is the Risen Elites. We went on your website. We were very impressed with everything that we saw. You kind of talked to us a little bit about health and wellness, but for you personally, what does health and wellness look like, ideally? And we know that, as us all being providers, I mean, Dr. OFORI is on the line too. He's a scientist. Health and wellness necessarily does not reflect a certain weight, right? As a provider, they're always teaching us, height, weight, BMI, but health and wellness goes beyond that, right? Yeah. So that's what we want to kind of explore today and, share with our viewers. So what does it look like to you?
Well, health and wellness, as you said before, it doesn't really reflect your weight. It reflects, to me, your stamina, your ability to, do regular daily activity with no confrontation. and deciding on the type of food that you eat and knowing the type of things you're putting in your body, having that health, that education, that informative education to know what you're putting in your body. Lastly, for me, it isn't about your weight. Like you said, it's about your physique, how you look. People don't believe that I got to a point where I was full muscle, but my BMI was very low. So that was maybe like my BMI was probably at 8%. I got my BMI pretty low, and I got my fat percentage to about 8%, but I still weighed 230 pounds. I was solid. So it looks different than the person who says, yeah, I'm 230 as well, but your BMI is, way past 25%. It looks different. People shouldn't look at the scale. The scale only tells you a little bit of the story, doesn't tell you the fullness of the story. And so health and wellness what you're putting in your body, like I said, and understanding that the scale is gonna lie to you, in my opinion, because you can look 150 pounds, but you won't look like 150 pounds.
Absolutely.
And understanding that at the end of the day, the things that you do put in your body will affect you in the long run.
Very, very important. I love the fact that you said that you'll look 150 pounds, but you won't look 150 pounds. Very, very important. And I think that's where a lot of people kind of get discouraged with health and wellness. When you go to a doctor's appointment, and you'll find out, of course, when you start seeing patients, because no matter what field you are, primary medicine always incorporates into everything, right? Especially you spoke a little bit about diabetes. So you're always going to be talking to your patients about different things. And that's one of the hardest conversations to have with any patient, right? Telling them that, by next visit, we want to see that maybe you lose like 5, 10 pounds. I mean, Lord knows I hate to hear that. When I go to my provider, they're all, they tell you what to do, and you're kind of like, oh, you'll do your best. But it's definitely something that is worth it. And I like the fact that you are advocating it. It's important to see people that are young advocating it. You don't see it often. So I want to encourage you to continue to do it and help people however way you can. If anyone has any questions or concerns, be open and willing to be able to assist people through that process. So tell us, when you do complete your degree, how do you plan to now incorporate Risen Elite with the podiatry degree? That's going to be double force awesome. So how do you plan to manage both of those?
And so what I've come to conclusion is that, I'm going to be in a space where I probably will be doing a lot of surgery, right? And in that realm, there's physical therapy that have to be involved, right? And so, I'm looking at fitness and I'm saying, well, that can definitely marry everything that I want to do. Okay. And so how I preferably would like to encounter it is having a one-stop shop for everyone who has any sort of podiatric needs. And getting everything in-house. So if you need some training to lose some weight, because sometimes that's what happens, when it comes to diabetic patients, at times it's literally a diet and how big they've gotten their BMI. That can help. That can really have an fluctuation in insulin, and how big you are, how large you are, how much food and kind of food you intake, can have an impact on your health. And so I think that's one small component, being able to have that background of knowing how people can lose weight and how to do it. Now I can actually teach people how to lose weight and do it while being a physician, instead of saying, hey, just lose 5 pounds. I can tell you how to lose those 5 pounds. And so I think that was very important for me specifically, in order for me to be able to help the masses, how I said before. So that's kind of how I want to marry everything together. Like you said, health and wellness goes hand in hand with literally everything. Dr. OFORI's here, understanding your medication, etc. Those things all, married together. Dr. CROMWELL, working with your patients. All of these things are kind of like a link, a chain. All these parts are very necessary in order for someone to improve their health. And I think that I don't want to miss any part of that, And I also want people to carry on, on their day-to-day, being healthy by themselves. I don't want them to have to come to the physician and the physician have to tell them how to be healthy. They should learn how to be healthy for themselves so they can carry that longer. And that's my goal, yeah.
And you have such a great spirit with it. And I think that's very, very important, because a lot of providers, we meet a lot of older providers, right? So they're tired a little bit, right, Dr. OFORI? Everyone's kind of like, the run of the mill. But it's good to see people who are young, energetic about their job, really looking forward to see people's best life. I think that is very important. And that's what makes a difference with seeing people who are like you, young like you, and going into this field of medicine. So, of course, and I told you right away, I was like, I'm in tears, I'm excited. Remember when I texted you, I was like, this is like so amazing. I'm so proud of you. And I truly am.
Thank you
Now,
so much. Thank you so much.
You're welcome. How do you plan to incorporate that in terms of Ghana, right? Because in Ghana, things are very different there, right? We're, Dr. OFORI and I always talk, we're still working on trying to get like primary medicine perfected. So now we bring in your specialty with podiatry. How do we plan to work that in the Ghana health system?
For me, primarily, I still want to figure that aspect out. When I went to Ghana the last few times, I went to go and enjoy. And I think this time when I go, I'm really going to sit down and look at what healthcare has become there. I know that it's not the same, and it's gotten a little better, but it still has some ways to go. One that I have learned is that, at times a lot of us, we want to get the education here and go to Ghana and help, but we're only doing like a minuscule part of it, a very small, tiny part. Going to do it, even if I committed to, let's say, 10 surgeries 1 month or whatever to go and help people in Ghana, limb salvage is a big thing. Oh, yeah. And when I speak of limb salvage, people who have had diabetic complications and now they either will die or they will cut off their entire foot or their entire leg. These are the patients that I kind of want to have impact on, preventative medicine, so it doesn't get to that point. And so I think me personally, I want to have some type of specialty in limb salvage. Okay. And so I'll be able to take that to Ghana, but ultimately I do want to educate others so they can do what I do in Ghana. I think if I can educate others with the education that I've received here, I can help more. I can really have a bigger impact on the masses. If I can train 10 different physicians on how to properly, debris a leg or, help save a leg and have a better impact on that, and they can go off and save another 1,000 other patients, I've done my job. Absolutely. More than that. And so that's been my mentality. My mentality is to educate myself as much as I can and be able to take that education to Ghana. I think I really want to, enter the field of education. I was an educator for a bit with my master's degree, just teaching high school biochemistry, and I'm still continuing that this summer. And I realized that I have a passion for education. So I can still teach others how to do these things and be able to have that type of impact. A lot of times we get so stuck on, creating businesses in Ghana or, just having the pro bono, type of things. But what I've realized is that at times pro bono is the key for the moment right then and there, but that's all it does. It fixes that moment right then and there. What about tomorrow when you're gone? We still have to answer those questions. There's still people who can't get help. Tomorrow when you're gone, there's still more people who cannot get help. So what can you do? How can you impact that?
That's very good. I love the fact that you talked about that. I'm sorry, Dr. OFORI, did you want to add or you had a question?
I do have maybe a question or some kind of contribution. Of course,
thank you.
So one thing with Ghana is that, our problem is unique in the sense that a lot of people subconsciously, it's not like they don't think their health is important. It's just because of the hardship and what people go through, subconsciously do not pay attention to their health. Education is very important, no doubt about it. When you get to a certain age, you need to do certain screening to make sure you catch certain cancers and certain diseases. Preventative medicine is key. But what we found out is that, and when I was practicing in Ghana, it was more likely that a person will go to the hospital when they're really, really sick. Even sometimes when they are sick, I'll go to the pharmacy and buy some medicine to take the pain away, right? Without really fixing the problem, right? Until it really, really deteriorates. So education, I understand 100%. I agree that we need to educate our people, intensify the education, empower them. They tend to believe those who are educated more. Those who have worked in the health field, they tend to believe you, and you, like, I don't know how many calls I've had over the past 10 years, asking for something about how to treat a disease. Yeah. So hospital is not somewhere that's comfortable the way we rush to hospital over here, right? So these are all things that we tend to put into place. In addition, when it comes to like exercising, eating well, some people think this is which literally means those who have some money, and that's why they want to go and ride a bike. Right, right. Or they don't have anything to do. So the education piece is very important. So and you sometimes you hear this from very educated people. Being in school doesn't mean you're educated. You know what I mean? So again, we need to intensify the education, and I 100% support what you're doing, and I'm proud of you.
Yeah, that actually, thank you so much. Thank you so much. I really do appreciate the fact that you gave me perspective on, speaking about what really the problem is in Ghanaians and their hardship that they go through on the daily. I think that has molded, a lot of it shaped our minds. Sikanibre, eager for money. And a lot of times people do things that are unsanitary and unhealthy in order to acquire, that monetary gain. And what I've realized is that, education, like you said, is very important. Ignorance too is part of the blame, I think. And I think it also has a mix of greed. I think that a lot of times when it comes to us looking at the dynamics of our people, we don't really look at, the full scope of things. Everyone has their own agenda. And I think that's the problem that's separating us at times. The people are the people. They can do as much as the people can do, but I really do lean on the government in order to fix certain things. And, it's all political, which is a part of the aspect that I also will be endeavoring one day, because that's the only way to get change. I'm being honest, to have effective change, you have to have policies in place. And what I realized is there's not much policies in place, right? And so what does that do? That gives you, chaos. That gives you, no mindset change, no direction, no trajectory, and in healthcare, if you have no trajectory, it's kind of like, well, either you get sicker or you get better, right? And if you don't have a mindset on what kind of trajectory that person should have, then you're kind of lost as a provider. You're not sure what next steps to take. And so I think that is a necessary thing right now. I know Ghana has a long way to go, and but it still takes us. Like, we still have to continue to add to that mix of trying to fix things. Things are not going to be fixed tomorrow. And like Dr. OFORI said, people being able to go to the doctor, that's a privilege.
Yes.
And me and my friends just spoke about this the other time, speaking about privilege, being able to come to America and have privilege, have free access to healthcare. Even though some people who may struggle with access, at least they have free healthcare.
That's right.
You see, in Ghana, sometimes they will not give you free healthcare. And then some people don't have that luck. They may die before they even have the access for them to even have that free healthcare. And so, looking at other places, looking at different third world countries like India, they call themselves a mega powerhouse when it comes to medicine. You understand what I mean? But their population is different. Their outcomes are different. You look at places like Asia and in China, where, they are one of the other mega health populations that have a really high, success rate when it comes to certain surgeries and etc. But still, like you said, education does not mean you're educated, and I think a lot of Ghanaians are extremely educated, but on how to run it and how to make it seamless, we still need to have insight from others and still get, other things for us to mirror. Yeah.
Absolutely. And so that brings me to my next question. So what can we do to change the narrative? I mean, we are all people who are educated here, right? Have different perspectives that we want to do back home. Dr. OFORI being a pharmacist, me being in family medicine, you going to be doing your podiatry. What are things that we can do? This program actually is a great stepping stone, right? It's a great format. We have people from all over that, watch and get to learn about things. But you talked about fixing the country, which is a huge protest going on in Ghana right now, right? Fix the country. People are like, some of them fix yourself, but it's probably a good combination of both, right? But what can we do? What can the people who are here, people that look just like you, people who are your age, right? What can they do to secure a better health care future for people in Ghana and Ghana in general? What do you think?
That is an extremely difficult question. This is something me and my friends talk about all the time. We speak about us going back to help, but we always say, in order for you to help, you need what? You need money.
Yeah.
Let's not play. Health is expensive. and one thing I've realized is that when it comes to Ghana, we as a country, there are some things that people take for granted, like not paying taxes. Okay, and that's the true thing, and that's a true statement. And the reason why I say this is because in other places like America, where we have people who pay taxes, they resource and they refund that money back into giving other people free healthcare.
Right.
We don't have that. We don't have that. So what else can we do? How can we get free healthcare if it costs money? Right. A lot of people resort to fundraising and asking donations. We're talking about NGOs, etc. Other countries who may donate towards, African countries. And I realize that some people do get greedy. And one thing I do understand is that me being a Ghanaian, honestly, I don't want to ask help from other countries. We can do it ourselves. We as people can do it ourselves. I think it is when we shift from the mentality of Obiafonoho into the mindset of conclusivity. We have to be all very understanding that we as a coalition, we as a people have to be together. And so one thing that I realized is that in order for us to even have effective change, right, is for us to get the education. That's a step one, taking that initial step to offer the education to others, and still providing that education to others. Like, hey, you can't just go to the pharmacist when you are have a fever, et cetera, and ask for paracetamol. You're just masking, whatever the case may be. You might have a deeper infection, educating people, understanding, antibiotics, all these things that they take on the daily are not something you're supposed to take on the daily, because later on you can become immune to them, right? When you really need them, you become immune to them. I think that education should start now. The next phase to me personally is definitely finding the source of funds. Ghana, we are up and coming country. We are a tourism country, right? And so one thing that I've realized is that, in tourism, that is how a lot of these other countries have wealth in tourism. And Ghana has not been put on the map. It's not been put on the map because I hear my friends who are American, whether it be Black, white, Asian, they're like, hey, I want to go to Ghana this year. I heard there's a big thing going on there.
Right.
And if my friends who are from this country, who once before were ignorant of Ghana, now want to go to Ghana, that means tourism has come a long way. Tourism in Ghana has come a very long way. So how is we as a people, how can we benefit from it? That's what the government should be thinking about. Tourism brings money, right? And tourism brings value. But we should also realize how we can outsource that sort of funds to provide what the people need. It's going to take some time. It's going to take some convincing. So I know there's people who don't want to give up money. You get what I mean? They want to use that money for whatever it is. But at the end of the day, you're talking about a Ghana that's a better Ghana. You're talking about a healthier Ghana. You see?
Absolutely. And you spoke about tourism being a great way of making money. And I was very, very excited with the year of the return, all the people that were going back to Ghana. I was actually in Ghana around that time. But what scared me the most as a provider is that if people got sick, I thought to myself, oh my God, the healthcare system in Ghana is such a way that these people are traveling here, right? If they get sick, and the way we treat people back there, right? Even, you meet with providers, you try to collaborate care. Everyone's like, oh, I don't need to call you back. It's that mentality. I was like, pretty much excellent care, right? For the most part, you can report any doctor in the hospital who doesn't give you your report. You can report anybody who doesn't give you your whole treatment plan. They don't have that in Ghana. So to me, opening up the country to bring people there, I love it. But we've got to fix our healthcare system, because when these same people get sick, they're not going to be used to that kind of treatment.
No, and they're definitely not going to come back after, right?
Exactly. That'd be their first semester.
You want people to come back. You don't want them to be scared. Like, hey, if I get sick here, something happens, there's no one or anything that can help me.
Exactly.
That is a problem we definitely need to fix. I remember watching a video. I know some people have their own opinions about this, man, but Honorable Kennedy Ajapong, speaking about his experience in healthcare in Ghana, and then him having to have an emergency flight to Europe. And I'm thinking about it, and I'm saying, these ministers and these people higher up, they do give people the chance to care for them. They do offer the chance, but I think sometimes in the field of healthcare, some Ghanaians don't understand that it's still a job. Yeah. It's still your job. You still should treat it as a job. But when they get to a certain place, it's, oh, okay, don't worry, you'll wait. There are people who, like my grandmother had an appointment. It was years back. I had to diffuse the situation because things were getting out of hand. But the doctor was late for 2 hours late.
Oh no.
You know, and I'm thinking about these minuscule things, and I'm like, that makes a difference. You know, you being 2 hours late makes a difference. That means you probably, in the end of the day, you probably won't see a patient or two. Number one, and number two, that also means that whatever we had scheduled today, if it was that of an emergency, we probably wouldn't be able to have today. Which means that person would be in more agony and more pain. You know, so at the end of the day, I really do push our Ghanaian leaders to, you know, really have some type of effective change, and that's policy. That is about policy. Not everyone can become a doctor. As you said, you can have education, but you can get the education, but that doesn't mean you're educated. You know, just because you are a doctor doesn't mean you are a doctor. A doctor to me represents a person who is helping, who is healing, who is taking the compassion mindset to help and help others. But if you don't have these things, these qualities, are you really a doctor? You're not a doctor. You're just a person with education who knows how to do it, but you're not really a doctor. A doctor is a passionate person. If you have no passion, pass the baton to someone else. There are many eager people. You know? Yeah, it's gonna be some backlash, I think, before that change happens, but I definitely see it happening.
Yeah.
You know? It's gonna be a turning point.
And we see you at Parliament giving all your advice to people and encouraging people, especially our youth, right? I feel like if the youth here, or youth all over, right, that are growing up right now, put themselves together in a way that they can go back to Ghana and create this change, it will happen, right?
Mm-hmm.
But if we don't, and if we sit down and we all like, that's why I'm both sided with fix the country and fix yourself. I think it takes both people. But yes, what you said is very true about policies. Certain policies and procedures, they work here, right?
Yeah.
You know that when you go to a hospital, a doctor or a nurse or a pharmacist or your healthcare team has to provide you that information. You know, you sign papers about HIPAA.
Yeah.
Things in Ghana are just so, I don't know. Does HIPAA even exist? Before you know, somebody would be like, I'm taking care of your aunt in room so-and-so, and she has, there's no privacy. And that's why people are so afraid. Honestly, that's why people are afraid.
Actually, you're actually right. Even if you think about it now, even our parents that have migrated from Ghana and that are here now, you know, at times when they get sick, they like to keep it in house.
Right.
You know, they like to keep it in his house, so they don't want to go to the hospital because they might meet somebody there. You know, sometimes they are scared. Oh, I will see so and so because they work there, so I won't go. What do you mean you're gonna see so and so you're not gonna go? You better go to the hospital. What are you talking about? You know, why are you worried? Why are you worried about Auntie at the front desk? Go to your appointment.
Well, because Auntie's gonna share the whole news with everybody else.
That's what I've realized. You know? There's no privacy, and that's the mentality that us Ghanaian people have when we think that it's okay.
Yeah.
No, that's something we have to change. You know,
right?
That's something we have.
I think the fear of healthcare, the fear of a hospital, could be very predominant in Ghana, but then even in the US, it exists.
It definitely exists.
Even if you look at how COVID kind of swept through certain class of population in the US, it goes to tell you, and there's a direct correlation between that factor and how COVID was able to kill a lot of people. It's just some innate ability that we do have, or innate thinking, like you said, that we are scared of the hospital. Some of them are historic. Some of them too are like, we think we're so strong, and prevention is better than cure. We always say that. Yeah. So I agree with what you're saying. You gotta, if you have any issues, you should see a doctor and you'll get it fixed before it's too late.
But part of it too, like you said, that fear. I think the fear is also about the money.
Yeah.
I think healthcare isn't cheap and healthcare is expensive. You know, some people are charged $700 for an ambulance ride alone. So I understand. Yeah, I understand that healthcare is expensive, and the fear also about knowing, if I go to the doctor and I do get it fixed, you know, tomorrow I'm going to have this big bill. You have to understand, a lot of these people don't have that resource. So I see that. I understand that. But one thing I do know about this country here is that we do have free clinics. Yeah. And a lot of times, you know, it's really about the access to those free clinics. That's been the biggest problem. But we have them here, you know. In Ghana, I don't really hear much about that. The government offering such free health care and that being something that people can go to on the daily. There are so many establishments and so many different sectors of that here in America that, sometimes I even become ignorant, like, oh, this is something that we should be doing in Ghana. But I have to understand that it really is a subsidiary to what they're doing on the main scale. And a lot of times that takes finance, right? That takes funds. And those funds are embedded into their system that they put in place years ago. So it's easy for them to do that now. That's why I'm saying in Ghana, it's going to take time. It's going to take time for change. It's going to take years. It's going to take as a lot of energy. It's going to take a lot of expenditure of funds and etc. But I know we can get there. We can get there. And like you said, it takes about the youth, us wanting to do those things. I know people who want to do those things, but they get frustrated.
Yeah.
They get
You're right. Mm-hmm.
Like you said, you want to come in there and become a collaborative effort, but people are dismissing you. Oh, what do you know? Or what does this person know? Because you're young. I know doctors who are 24. There are physicians who are 24 years old. They are full-blown doctors. The education that they were given to them is the same education as a 50-year-old man.
Correct.
But because of their age, who are you? And one thing I've learned is that, sometimes we have to really sit back and recognize what's the most important part.
Absolutely. We're going to go ahead and open up our phone lines if anybody wants to join our conversation, of course, and ask me questions to Dr. OFORI or Isaac. Our phone number is 773-312-0318. You can call in your contributions, or you can go ahead and send us some comments. I do see we have some comments here. I haven't forgotten about anyone. I was just trying to get us through our conversation. We'll take a quick break. We'll go ahead and read everyone's comments. And of course, our phone line will be opened if anyone wants to join our conversation. Stay tuned and we'll be right back. This is the Health Talks.
Hi, my name is Ochiame Kwame, the rap doctor, and I have something to tell you. When you need a doctor, you mustn't go anywhere. All you have to do is to call mobile doctor. They will send a doctor to your home, send a fleb to come and take your blood sample.
I will authorize the pharmacist to bring the medication to your home. Don't go anywhere. Mobile doctors will bring everything to you wherever you are.
If you are looking for a discount, just call and give them this code OKMD and they'll give you an amazing discount. Mobile Doctors is my choice and I recommend it for you. For more information, log on to www.mobiledoctors.net. Mobile Doctors, the doctors in your home.
Are you sick or have a health emergency and don't want to wait in long queues at a hospital, especially during these times of COVID-19? Worry no more. Dr. Noun GH will bring the hospital to you. Now at your fingertips, you can see a doctor of your choice. Simply download the Dr. Noun GH app from your phone's app store. Don't wait. Hurry now to sign up for free. Dr. Noun GH, your doctor is now at your fingertips.
My name is Eunice CROMWELL and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
My name is Eunice CROMWELL and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Welcome back and thank you once again for staying tuned with us. We'll go ahead and read some of our comments from our live feed. Royal Black Jesus, which is our producer, we thank him so much. He said, very good show, very educational. Dr. ARABA, thank you. We have Sylvester watching. Dr. Edward OFORI, of course, is with us. Royal Black Jesus goes on to say, wow, I'm so proud of you, Isaac. Johnny Woods is watching. Nee is watching. Sarah's watching. Pakwasi Sam, who is the president of the Ghana National Council, says, Good points, bro. He's very excited. They're all with us. Thank you guys all for watching us. We have a lot of people who are tuning in and watching us. Don't forget to send your contributions and any of your comments. We really want to hear from you all. And this is a very, very interesting topic. And of course, this month, we are just going to be dedicating it to following up with all of our Ghanaian youth. Remember, Ghana National Council is looking forward to promoting everyone who is doing anything pertaining to education. We have seen people graduating from preschool, from elementary school, from high school. We are excited for you all. We know this was a very difficult year, being that we just went through COVID-19. So everyone who has done something, everyone who has graduated, we are very, very proud of you. Remember to send your picture to Ghana National Council. You can send it to me via WhatsApp. You can send it to any of your affiliate members and they'll get it to me. And we are preparing something very special to be shared through our picnic, which brings us to my next announcement. Ghana Fest is always awesome, right? But we are going through a very interesting transitional time. And though the city has been opened up, Ghana National Council still wants to take some extra precautions. So we are not going to be having a full-blown Ghana Fest, but we will be having a Ghanaian community picnic, which will be happening on July 31st. We're still working for the best park. We're looking for somewhere in Chicago, somewhere in Bolingbrook. We don't know yet. We'll have that information very soon. But bring out your family, your friends. We'll all be joining us there. That will be from 11 to 8 p.m. July 31st, which would be Saturday. That's always the Saturday we normally have Ghana Fest. And then be rest assured that next year Ghana Fest, I'm so excited. I don't want to give anyone any hints, but it's going to be above and beyond, right? We've been out for 2 years, so we have enough time to gather the best for Ghana Fest 2022. We'll continue our conversation with Dr. OFORI and Isaac. And so we are almost towards the end of our program. Is there anything else you wanted to inform us about? You know, you told us about your Risen Elite. How do we get a hold of you if we wanted to join your program or anything like that? Any information?
At the moment, I've actually taken the time apart to not train anybody. Okay. I didn't want to commit to doing so and not having, my full breath and attention towards it. I think in the future, what I'm going to do is I'm going to continue to produce, some type of content that helps others in their journey, in their fitness journey. And I'm also going to produce videos and etc. Programming, I'm almost done with them. I'm actually finishing them up. Hopefully by the end of July, I would have some of them posted for those who are looking to lose weight, gain weight, or whatever their goals may be. So that's how I'm going to kind of carry that.
Okay. So for right now, you want to take some time off, but you'll still be dedicated to providing some virtual assistance, which is also awesome. I think that we talk all the time about how telemedicine is really, really big through COVID, but so has virtual fitness. There was a patient of mine who actually lost about 25 pounds, and she told me she did it through her Apple Watch. She said there were some programs and some videos that she watched and she just stayed committed to it. So I like that you are also taking your platform virtual and people can still keep up with you and be able to lose the weight. And then also still give you the credit, right? We'll still be able to say that Risen Elite helped you lose this weight or gain this weight, whatever your goal is. So that's awesome. I'm really, really happy about that. Now we talk all the time to people, and I'll ask you the same thing. What does evidence-based care mean to you?
And so when it comes to evidence-based care, that means someone has sought and looked out for the question that needs to be answered. And what they've done is they provided all of the statistics and data and analysis, right, that supports their decision on caring for their patient. And so evidence-based care, that is something that is essential, because one thing I've realized is that the books right now, the medical books and journals and that sort are predominantly white. And so with that evidence, they try to use that on a national grand scheme. And some of those things don't work for people who look like us, black and brown people. There are different, stats and levels that we should go based off of that. And I think we're trying to find a better alternative. And there have been much of a movement when it comes to that. People who may have certain skin ulcers don't represent the same when it comes to a African American. They don't look the same as it was in the book. And so I think a lot of people are outsourcing that type of thing. And evidence-based medicine is something that we should stick by, though. However, I think that when people try to go to the pharmacy to get medication like they do in Ghana, to me, that's not evidence-based medicine. You don't even know if exactly what it is you're treating. And you need to have that physician who has the experience and has the evidence with the science, right? Because science is ultimately what we're using, the applied science, in order for the person to be healed.
Absolutely. Very, very, very well broken down. Dr. Ford, do you have anything?
I just have one thing that you're fully responsible for your health, right? What you put into your body is what's going to come out. If you put garbage in, you get garbage out. If you don't exercise, you cannot get up one day and say you're sprinting, right? You got to start gradually. So yes. So personally, I think that health is a conscious thing. It's a mental thing. It's not something that you just get up one day and say, that I'm healthy. No, you got to do it's. You got to it's like school. You get to kindergarten, you get to primary school, the stages of it. So it's not an abstract thing. It's real. You got to work towards it. And I believe if most of us do, there are certain diseases that even if genetically we are predisposed to, we can delay the onset of these diseases because genetics is fed by what you give it. So that's what I will have to say.
Absolutely. And that's very important because I think that some people will say that, oh, okay, I have diabetes because my mom had diabetes or my dad had diabetes. But you're right. You can change that, even though there are predisposing factors for many diseases that are preventative, but there are things that you can change. So when you go to your provider's office and they're doing your preventative medicine check and they're telling you that if you do this, this and that, in the future, you can maybe reduce your A1C. You can reduce your, LDL, your HDL. These are all things that we should take very, very serious. So thank you for bringing that to our attention.
Yeah, and I want to piggyback off of it.
Yes, absolutely.
Like before you said, definitely you're right. With the genetic aspect of, trying to slow down that a lot of people don't understand that, but that's a really big thing. We speak about cancer, we talk about carcinogens, we talk about teratogens. These are big words, but basically what they mean is that some people wake up one day with an ailment based on their lifestyle, and it literally took their lifestyle, just for them to be as sick as they are now. And if you think about it, why not prevent that from happening? And so you're completely right, Dr. OFORI. That was a definitely good outlook when it comes to evidence-based medicine. Mm-hmm.
Absolutely. Thank you very, very much. We're going to go ahead and check. Have any more comments? Oh, we just have a lot of people watching. But guys, please send your comments because this is a rare moment. Any questions or things that you want to add to the conversation is definitely well received. We've been talking about a variety of things. We've been talking about education, how to pursue forward in education. Very, very important. We have a lot of people who really don't know what they want to do. And being a strong advocate of education, like all of us are on here, I really want to encourage everyone, people who have just finished high school, don't give up. Don't give up. Don't take the cheap road and say you want to take 1, 2, 3 years off of high school to work, because that job, that minimum wage job that you're going to get, in the end of the day, you're going to regret it. And I'll just say it. You need to push forward. You need to continue going to school. Even if you take your time and you don't know what you want to do in the beginning, keep on taking your courses. Keep on keeping in touch with your academic provider. Before you know it, you're going to get to where you need to get to. So please, guys, let us stay focused. Let this be the year of change for everyone. Anyone who is sitting down watching us and saying that, oh, I just want to relax a little bit, you can relax later when you get your career. So go for it. Go straight for it. We have a question here from Mawasi. She wants to know, what do you think about the keto diet? Isaac, we'll go ahead and give that question to you. And people love the keto diet. What do you think about it?
Okay, first and foremost, I am not your provider. So let's start with that. To give you my spiel, I'm not your provider, but I will tell you all of the evidence.
Okay.
Keto diet, there is no evidence-based, right? Evidence-based analysis or conclusions as far as it goes long-term.
Okay.
Long-term, what keto diet can do to you in the long run. So that is something that's still a question till today. However, keto diet can get you a lower BMI. It does work, but it is a process. Okay. And the one thing you need to understand is that you continuously messing with your carb intake or not, you can either stick with that or you shouldn't do it at all. Inflation and, fluctuation of your carb intake, can cause damage in the long run. We're not sure what that's going to do. If you decide to do keto diet for only 4 weeks, right? Some people do keto diet for the rest of their lives. They stick with it. And so if you do keto diet for only, like, say 4 weeks, and then you decide to just go back to how you were eating before, and then you do keto diet again, you have to understand your body's going through so much change. The first 2 weeks of keto diet, they always say prepare for the flu. There is something called the keto flu. And with keto flu, you feel down. You feel like you have the flu. It's almost like you feel like you're sick, but you're not sick. You're not sick. It's not really a virus of some sort. It's literally the amount of carbs that you're putting in your body, and the fact that your body has now recognized, like, hey, I can't use the carbs I used to use before. So it has to you're tricking your mind into using the remaining fat that you have in your body, right? It's still dangerous, in my opinion. It's still a diet that you shouldn't just do if you have no experience. It took me playing with it in order for me to understand what keto truly meant.
Okay.
Right? And I decided, you know what? I don't want to do keto. I'm going to do low carb. Now, that's a better alternative. A low carb diet just means that instead of eating a cup of rice, you've deduced yourself that you're going to eat 1/4 of that cup.
Okay.
You're going to maintain under 150 grams of carbs in a day. Some people, I always tell them, stay under 100 grams of carbs, depending on, their goals, their fitness goals. Staying under 100 grams of carbs, that means you have to know your nutritional value. So you really have to keep count of what you are putting into your body. The general rule of thumb is that if you want to lose weight, you can stay under a caloric intake, right? Stay under caloric intake, you're going to lose weight. That's the general rule. But the thing is, with some people, they have specific things they want to do to their body. In my opinion, going keto is very hard on the body. Okay. We are naturally born to eat carbs, and our carbs are used as fuel. Okay. So now when you eliminate them entirely, you're using another source of fuel, we would say fat, right? But you also have to understand that your body has to go through a process to switch from taking carbs as energy and using fat as energy. Okay. And that's okay, but it's going to get a point in time where you really want to eat some fufu. Okay. You're going to look at that fufu. If you eat that fufu, you're not going to be in ketosis, what we call ketosis anymore. Ketosis is the system in which it uses ketones in your body. You create ketones, almost like acids in your body, right? That helps melt the fat away. Now, if you go out of ketosis, you have literally reversed what you were supposed to be doing. Some people can jump back into ketosis easy. Some people may take a couple days. Or some people, they have to start from the beginning. So that feeling of feeling sick, all that feeling of feeling lackadaisical because you're not eating as much carbs, is gonna come right back. That's where people don't know if that is causing more good than harm to the body. Okay. So I always advise people, if you want to lose weight, low carb diets.
Okay. Low carb.
Low carb diet. Switch things out. When I say switch things out, some people, they would love to, they don't know exactly what they're eating. They say, yeah, I just eat this, I just eat that. But if you look at the nutritional value, it's almost 200 grams of carbs. Plantain chips, just one big bag of plantain chips has 800 grams of calories. You know, people think about calories, that's a big thing. And thinking about carbs, that same bag has almost 170 grams of carbs, if I'm not mistaken. That's a high value of carbs. Like, that is a lot, you know, if you're thinking about it. The more carbs you consume, right? In my opinion, the more carbs you consume, the more calories you're going to add.
Okay.
So it's ideal to reduce the amount of carbs you're intaking. Bread, you like bread. Some people are lovers of bread. That's fine. You can still eat bread. Just make sure everything else that you are eating has been minimized. Like, you have to minimize everything that you eat. Portion control, like I said, some people don't understand portion control. Understanding portion control is going to help. You know, balling your fist to know how much meat you're supposed to eat in one sitting.
Okay.
Is what I train people. Meat, some people don't like meat. I love meat. Meat is high in protein, right? And low in carbs. Low in carbs means that I can eat more of that. What you should look forward to is eating a high dense protein meal. Okay? High protein dense meals are very important. You know, so what I used to do when I used to live at home, my mom used to make stew, or she would make inquine, and I was trying to be modest of what I was eating. If I didn't want to eat food for that day, I was drinking soup and I was eating the meat.
Okay.
You know, if I knew that I had too much carbs today, like the day I've been eating burger, I've been eating it, I'm like, let me try to keep it light. You know, you can literally just eat the meat that's in your food. Another alternative, instead of eating so much rice, some people like brown rice, which is cool. But if you really want to go to the extreme, there's something called cauliflower rice.
Oh, okay.
No, Ghanaians don't know anything about cauliflower. Cauliflower rice, it tastes different, and it's still a vegetable. It's a vegetable. It's not going to taste like It's not going to taste like rice, but at least now you've cut down so much carbs and so much calories in your food that you're still eating some of your African food, which I'm telling you, I'm being honest with you, it's really not that great if we think about it, because all the oil that we put in our food and stuff, but still, it's a different alternative. And a better one than just saying you want to go keto. Some people can't take keto. How are you going to do keto if you never dieted before? Keto is a hard thing to do. The first time I did keto, I didn't know what to eat. I had no clue, no idea what to eat. If you're a person that's always on the move, you can't buy food outside, so that means you're stuck. What are you going to do? What are you going to eat?
Yeah, absolutely. I have a patient that did keto. She did it for, I think, 2, maybe 3 weeks. And she was doing really good. She's diabetic. And so we talked about her sugar and everything. And then one day her sugar was like 500 something. And I said, what happened? She said, oh, I ate a whole loaf of bread. She said, I couldn't take it no more. And she looked like a whole loaf of bread. So I really understand how you can crave something,
Yeah. It's not meant for the weak.
It's
not meant for the weak, because keto means you can't eat sugar too. And one thing people are addicted to is sugar.
Exactly.
Imagine people think it's an easy thing to do, and I always tell people it's not. I don't think that diet is something that you should step into. It's a really hard diet. Take your time and do other things.
Right. Yeah. And you talked about low carb. So for you, low carb, if you look at a plate, right? We always talk about my plate, right? That's what our nutritionist teaches us. So what does a my plate meal look like for you that's low carb?
That's low carb? I would definitely say, okay, and I'll give you what I ate earlier.
Okay.
So I love lamb shoulder. So I'll go and buy lamb. I'll season that. Mind you, I'm not putting so much salt. I'm trying to, be modest on my salt intake as well.
Okay.
So I have lamb. I would have a little bit of asparagus. I have a lot of asparagus, actually. A good portion of asparagus.
Okay.
Right. And then my carb of choice was some brown rice. However, I only had a cup. 1 cup already cooked, 1 cup of brown rice.
1 cup cooked, okay.
Already cooked. But later on today, I don't want to have anything that's too carb heavy. One thing I've realized, and some people don't think it matters, and it's true, some people say it doesn't matter for them, and I think it still matters if you're starting to get into the groove of things.
Okay.
Is watching what you eat at a certain time. And so tonight I'm not going to have a heavy carb-based meal, because that was kind of considered a pretty decently carb-based meal. I would say 50% carbs, in my opinion.
Okay.
Right? So later on tonight, I'm not going to have much carbs. If I wanted a little bit of rice, I'll probably have, a fourth of a cup. That's a couple spoonfuls. I wouldn't want to eat too much rice.
Okay.
There are other things that you can eat, supplement them with. There's a million different vegetables you can supplement your food with, But I always tell people, if you used to eat 1 full plantain, cut it in half and eat half. Okay. You're gonna lose weight.
Okay.
You're gonna lose weight. You're gonna feel better. If you cut what you're eating in half, especially knowing what it is that the problem food is, if you cut it in half, you're gonna see change. You're gonna see results.
Okay. Very good. And accompanying with that with exercise. And I know, so you are committed to your exercise. You go to the gym and everything. What about people who really can't go to the gym? What do you recommend for just outside activity? Because the weather is getting better, right? People can, go outside. What do you recommend for that? And time-wise?
Honestly, going for a long walk is very good.
Okay.
I always tell people go for a long walk. Some people can't climb stairs, so walking is definitely the alternative. If you can climb stairs, climb stairs. Climbing a high intensity level of stairs is just as effective as doing a 1 mile jog. You can definitely do that, right? You can climb stairs and lose weight. Some people like to walk on an incline, and so that means walking up a hill.
Okay.
Walking up and down up a hill is some of the best cardio. Actually, in the gym, that's what I simulate. I put the incline on the treadmill at the highest, maybe like 10 to 12 to 15, whatever the high level I can do, and I walk.
Okay.
And that already is burning calories.
Okay.
that's putting you to work. Yeah. The same amount of time of you running is the same amount of time that you will burn when you're doing walking up an incline. And so for some people, it's much easier to do that. So you can do those alternatives. So definitely walking outside. You don't have to do too much. People don't understand, but even doing things like cleaning, you can still lose weight from cleaning. Like, it's about
staying active. So you're just encouraging staying active no matter what.
Exactly. Don't just be idle. Stay active.
Okay.
Staying active is key. During COVID, I used to ride my bike.
Okay.
And some people didn't have that access. They didn't really have a bike. They couldn't go outside and whatnot. I used to run for a mile, things like that. I'll come home and do push-ups, stuff like that, and stay active inside. Some people don't like going outside. So what I did even originally is what I provided was bands.
Okay.
And resistance bands, so that's so you can do at home. You know, my father has bands. He's always at home doing arm exercise, do back exercise. So these are things people can do. They just got to find the thing that works for you.
Absolutely.
Yes.
And I think that's very important. And we really appreciate you teaching us all these things. We'll take a quick break. When we come back, we're going to hear his closing remarks. And I will give my closing remarks. And of course, guys, if there's any topic that you're really interested in, please send it to Trend Africa TV so we can be able to bring this topic to you. Remember that Health Talks is brought to us proudly by Trend Africa TV, Ghana National Council, Omama TV, Holiday Africa, and the Jemima Nuni Foundation. We're eager to hear your remarks, your comments, your suggestions. So make sure you send that in as well. We'll take a quick break. When we come back, we'll hear Isaac's closing remarks. Thank you for joining us.
Hello there. Welcome to Trend Africa, where we give you the best of live streaming across all states in the US. We also do web designing, event planning, MCing, app creating, and promotions. Or if you want to shoot an advert for your business or a show, you can contact us on +1 773 312 0318. For more information, you can visit our website at www.trendafricaonline.net and also on our social media platforms at Trend Africa TV. You can download our app Trend Africa Online on the Google Play Store and App Store. Trend Africa, redefining Africa.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for joining. Let me go ahead and just read some of our comments so we don't forget anyone. We have a message from Mr. Kofi Cromwell, my lovely husband. He says, great job, guys. Thank you, sweetie. We have thumbs up from Jeff. We have fire emojis from Timothy. Thank you, Timothy. Thank you, Jeff. And Pakwasi says, we need advice on losing belly weight. Why? Isaac and Dr. OFORI for African men. So yes, he's going to go ahead and tell us that in his closing remarks. Otherwise, we'd like to just give a big thank you for everyone who is joining us. It's always a pleasure to virtually be with you guys on Thursday evening. We are dedicated to bringing you guys the best information and also providing great things to help all of our health and wellness, especially with COVID the way forward, right? We started this program just talking about how we could deal with COVID when COVID goes down. Now that COVID is going down and Dr. OFORI has encouraged us all to get our vaccinations, what can we do to keep our health and wellness? That's why we brought Isaac here today. So we'll go ahead and let him answer the question from Mr. Pakwasi Sam, give us our closing remarks, and then we'll close the show for today. Thank you once again, Isaac, so much for joining us. We appreciate it.
Thank you guys for having me. Uncle Pakwasi, the way to go, honestly, you have to watch what you're eating. And I know a lot of people say that often, but when I say watch what you're eating, I mean, you need to understand the nutritional value of what you are eating. I think that your goal right now should, people always say they want to lose belly fat, but when you're losing weight, you lose weight all over your body. Okay. And it might start from your belly. That's probably where most of the everywhere. And I think that what you should do is limit how much you're eating. So you know how much before you eat, you know how much, whatever African food, etc. it is that you eat, you should limit that and cut that into half. In my opinion, cut it into half, like I said before. Some people, they always say they're gaining weight or they're still, they still have this weight, even though they eat maybe once a day. So I think you should change the mindset. Instead of eating once a day and eating a big meal, right, once a day, what you should do is eat throughout the day. And eating throughout the day, some people don't have the time or the energy, but if you really want to lose this weight, that is what's going to be necessary. You don't want to shoot your insulin up at night, just randomly in the middle of the night, right before you go to bed. Because ultimately what that's doing is you're just sitting with all of that energy. And when energy isn't used, it's stored. Okay? So when you're not using your energy, you're going to store it. Where are you going to store it? In your belly. So start with those type of meals. Whatever heavy meal, heavy food that you're going to eat, do that in the daytime. Why? Because you're more than likely going to be active throughout the day. Okay? So that's one thing. That's one step you should take. Watching what you eat and what time you eat it. How much you eat. You should definitely consolidate how much you eat. If you're used to eating one full bowl of fufu, cut that thing in half. Put the other half for another tomorrow. Okay. Always eat high protein meals. Think about your protein that you're putting in your body first. In my opinion, if you want to lose weight, think about the protein you're putting in your body. Okay? Have a high meal, because eating protein, I know some people say, oh, chicken and meat, I don't want to eat too much, which is true. You know, having too much red meat could be bad, but there is lean meat. Chicken, there's fish, there's turkey. Those are things you should probably eat first and eat plenty of. You're going to feel much fuller off of the meat than you will off of the carbs. And once you start to do that, and once you realize that you're going to be more fuller off of the meat that you're eating, the carbs that you are eating is going to be the last part of your food that you should consume, right? And you shouldn't consume a lot. Limiting yourself and knowing how you're full, when you are full, stopping when you are full, are also very important. Some people have different ways of how they go about that. Stopping when they are full. As soon as you feel full, don't overreach because you put too much in your plate. That's also a problem. You are going to gain weight. So don't overeat, you know, and sometimes it's about the chef too. Okay. It's about the chef. The chef knows what he or she knows what she's putting into. Okay. Sometimes you may not know, but you're going to eat it. Granted, I understand. That is fine. Be mindful of the amount of sodium you are consuming, though. Sodium is important. You want to lose weight? What's going to happen is you're going to be losing weight. You're going to be losing weight, or you're going to be doing things that look like you're losing weight. AKA, you might be running more. You might be dieting more. But the sodium that you're intaking doesn't look like it is. So when you take in water, all of your muscles suck up all of that water because your muscles are kind of salty. You have so much sodium in your body that is retaining the water. And retaining the water looks like you are bigger than what you actually are.
That's very important. Mm-hmm.
Yeah. At times people start losing weight in the beginning because it's water weight.
Water weight. Mm-hmm.
Water weight drops because they change how much sodium they're eating. And in that water weight alone, you can lose a couple pounds.
Yeah.
You know, you probably won't see a major difference, but you can lose a couple pounds. And once you have a very consistent level of your sodium intake, then you are going to see results.
Absolutely. Thank you. I hope that answers your question. Pakwasi said it's all African men. I hope that answers the questions for everyone. And I think that it's good advice for everybody. You talked about the time to eat. So at what time should be your last meal for the day in terms of dinner? What time is a good time?
I always say 3 hours before you go to. I mean, some people have different opinions.
Okay.
I know sometimes it's harder for people to, but honestly, realistically, the most amount of time you can have before you go to sleep, you know, I would say 3-4 hours. You know, okay. But before you go to sleep, you know, do something like just walk around, like just try to get your food to go down. You know, some people eat and they go sit down. You know, sometimes
they get full if it's banku or fufu.
They get banku or fufu, but the food they're eating too, like I can eat a low carb meal.
Okay.
I can eat a low carb meal. Let's say I'm having my meat, I'm having my vegetables, or I'm eating a salad, or let's say because there are a lot of things people can do. I used to eat low carb tortillas.
Okay.
With taco meat, or I make my own meat, my own chicken, right? And I'll eat that at night, right? And I will be full, but I won't feel heavy.
I see. Okay.
See what I mean? I can sit down. I'll be fine. I know the content that I ate is not going to make me feel less heavy, but when you're talking about dense food like banku and fufu, you got to move around. You got to make the food come down. Like you have to work it off a little bit.
Okay. Before you go to bed.
Work it off. Like walk around. Just walking around your house, like just to get your food to digest, you know?
Okay.
Sitting down sometimes it's harder for food to digest if you're sitting there after you just ate. You know?
Okay.
Trying to get your trying to get your heart rate up a little bit before you go to sleep is good too. That means walking around. That's good. That'll be fine. You know, that's honestly the only opinion I have when it comes to late night eating. And try your best not to eat things that have like high contents of sugar and stuff of that sort at night.
Right, that makes sense. And maybe take a walk, evening walk after your dinner, and then come home.
Yeah, coming home and rest. That's a good idea, I think.
Okay, that sounds good. We're going to wrap it up for today. I think that's all the comments we have here. So again, Isaac, we are privileged to have you here. We wish you all the best in your education. Just know that the entire Ghanaian community is rooting for you. In a couple of weeks, we will have Naps Butter on here, another great Ghanaian lady. I'm very excited to have her here. Like I said, I'm always on the search on Instagram looking for all the awesome things my youth are doing. So it's always exciting to bring that forward. So watch out for her program. It's going to be in 2 weeks. Next week, we'll actually have all the winners for our scholarship from Ghana National Council. We have 2 awesome people from Ghana and 2 people from here that won. They're going to come and tell us about the essays that they wrote. So very, very excited. So we're looking forward to that. Following that, we're going to have a very wonderful lady. She lives in Atlanta. She's coming to talk to us about health insurance and life insurance. She's also a doctor in Atlanta, doctor of nursing practice in Atlanta. So this month we are power packed and we are excited. Again, Isaac, we appreciate all your expertise. We wish you all the best. Please know that everyone in the community is rooting for you. I mean, we are always behind you, looking for all the great things you are going to be doing. We know that you're going to do wonderful things in Ghana as well. So this is your home. Whenever you want to come and talk and tell us about what you're doing, always come to Trend Africa. You have a home here. I'll go ahead and give you the chance to give your closing remarks.
Thank you guys so much. I appreciate everyone's support, love, and help. I think this has been an amazing journey for myself, and I think this is an accomplishment I want everybody in the community to have as well. You know, I think that in the long run, that I hope in the long run that I'll be able to see others just like myself accomplish greater things than I have. So this is everybody.
Absolutely. Thank you so much. In conclusion, guys, we've learned a lot today. Wellness is especially important as we age because regular exercise and proper nutrition can help prevent a variety of elements, including cardiovascular disease, diabetes, cancers, among others. Whether you are 20 or 80, wellness is important, and we should all assess our personal wellness goals and work towards them. Healthy lifestyle choices are not only to promote healthy aging, but also to provide us with self-fulfillment. Today, I will end the show with one of my favorite quotes from my sister Jemima. If the sun is not shining on you, let it shine through you. Until next time, I'm your host, Dr. ARABA. God bless you, and God bless our homeland, Ghana. Take care.
Royal Black says we are back, maka. Entertainment and sports, maka. I say politics, maka. Royal Black says, Assembly Safwa, Bia Assembly Puno, Sanepi Adekami, Ekome Yakotofumi, Ekome Yamisebe, you want love fake hanye, maka. Royal Black says we are back, maka. All the trending issues, maka. I say politics, maka. Entertainment and sports, maka. RBJ Diaba, where you full from crowd. Asemi Safwa, yeah, Asemi Puno. Sasemi Naba, yeah, Becca. Senya betino, sababe na yebekano. Maka, akesame kwedewo. Wabayuye no ni wona, je no na ke. Wabayuye no ni wona, je no na ke. Say a politisa, RBJ Becca, or Becca, a sponsor. RBJ Becca, or Becca, entertainment suhe. RBJ Becca, or Becca, trending issues. RBJ Becca, oh Becca, Maka, Yediabao, Becca, Maka, Yediabao, Becca.
This is the Ghana Agenda, and my name is Alfred Amuzu. On the Ghana Agenda, we talk about political and financial related topics occurring in Ghana. We try to break down some of the most complicated issues, and we make sure that all our listeners leave the show with something at the end of it. Again, tell your friend to tell your friend. Afraid of Moving is on every Sunday on the Ghana Agenda.
Welcome to Trend Africa, where we give you the best of live streaming across all states in the US. We also do web designing, event planning, MCing, app creating, and promotions. Or if you want to shoot an advert for your business or a show, you can contact us on +1 773 312 0318. For more information, you can visit our website at www.trendafricaonline.net and also on our social media platforms at Trend Africa TV. You can download our app Trend Africa Online on the Google Play Store and App Store. Trend Africa, redefining Africa.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.